Whenever we're going to be talking about the presence of the oral cavity lesions, the important example of oral cavity lesions that they ask you in the exam is going to be leukoplakia, and erythroplakia. Why I am making a mention of these two lesions is only for one reason. And the reason I would like you to have an idea over here is that these are example of lesions which are not to be confused with Leukoplakia. Leukoplakia, erythroplakia is an example of a lesion that is going to be associated with patients that is going to be associated with high in risk or development of cancer. Now, the kind of cancer that is going to be seen in the patients is what is going to be associated with something like squamous cell carcinoma. Squamous cell carcinoma. So whenever he's going to be talking about leukoplakia and erythroplakia, they will increase the risk of development of oral cavity cancer. Whenever he's going to be talking about Leukoplakia, that is going to be associated with the presence of the bladder cancer. Leukoplakia associated with cystitis or inflammation of the urinary bladder. Now, between leukoplakia and erythroplakia, the more dangerous condition that you need to remember over here is erythroplakia. The more dangerous condition that you need to remember over here is erythroplakia. Easily, you can remember that fact whenever there is a danger sign, it is indicated with a red color. Danger sign is indicated with a red color, so erythroplakia is more dangerous. The next thing I would like you to be familiar with over here is read the question in the exam carefully. Leukoplakia is not to be confused in the exam with the condition that is going to be given the name of Candida. So sometimes the patients are going to be having the presence of, Candida infection and Leukoplakia. They may appear to be similar because they can be having the presence of a gray-white membrane. Read the question in the exam carefully. Paper 2 question will tell you a patient comes to you because he's having the presence of a gray-white membrane in the oral cavity. If it is a Candida infection, there are two hints that you get. If it is a Candida infection, there are two hints that you get. One, the immunity of the patient is going to be less. Second is, in case of Candida, this is an example of a removable lesion. You can scrape it off. You try to remove it, you can scrape it off. Candida is an example of a removable lesion. But in case of leukoplakia, please remember, leukoplakia is not non-removable in nature. Right? When there is Candida infection in the oral cavity, that is what is going to be given the name of thrush, oral thrush. So this is obviously going to be a ENT/micro question that are going to be asked in the exam. Oral thrush is an example of a lesion that is caused because of the infection caused by Candida albicans.